Hi, my name is Kelly, and I'm an addict. But I didn't get my drugs off any street corner or from any drug dealer. I got my prescription from a prescription pad and my doctor. I would like to talk to you in my story today about my 10-year addiction to the attention deficit hyperactivity disorder medication, Adderall. I want to tell you about the effects it had on me mentally, physically, and emotionally. I would like you to see the dangers of this highly prescribed drug, the abuse potential, and persuade you to see that this drug is a dangerous and extreme option for coping with ADHD, regardless if it comes from your doctor. Some say Adderall is overprescribed, and some argue that if it's overprescribed, it must be working. I'm not exactly sure about that. Because it is the first and only class of drug prescribed to anyone who walks in a doctor's office claiming they're ADHD, I can see how it's overprescribed. Whether it's really helping you or making you high, the doctor will keep writing the prescription. Adderall is a stimulant drug and is part of the amphetamine family. It's classified by the Drug Enforcement Agency as a Schedule II controlled substance, which means that it has high potential for abuse and addiction and is extremely dangerous. I'd like to point out that this was never part of the label on any of my prescription pill bottles. Other drugs that fall under this category in the medical dictionary are dextrose and Ritalin, which are also prescribed for ADHD, as well as opium, methadone, methamphetamines, morphine, and cocaine. Abuse of any of these drugs can cause severe psychological and physical dependencies. I found that addiction is the #1 side effect to Adderall, a drug so freely handed out to children, teens, and adults. Why are amphetamines so easily put into the hands of anyone who says that they're attention deficit? While cocaine and morphine are given under special circumstances and then are even carefully administered and monitored. This extreme addictive quality of Adderall should be carefully explained to a patient and supervised as well. This was not explained to me, and this is where my story begins. I was 19 and going through some things in my life, accompanied by the teenage blues. I decided to see a doctor about it. At the visit, I had explained the history of my depression to the doctor and also explained I was diagnosed with ADHD in the past. Immediately, he pulled out his prescription pad and wrote me a script for Adderall. He said it was just what I needed. I filled the prescription and popped my first pill. The drive home was the most exhilarating and exciting thing I had ever experienced in my life. I felt so alive and I never looked back. All I felt from then on was happy, so the drug seemed to be working or doing something to me. That was good. I didn't know what it was really doing or that the mania that followed was about to steal 10 years of my life. This high euphoric feeling that comes from Adderall kept me taking the pill. But the problem with drugs is that the more you take, the more you need. Especially with this drug, because your body becomes so dependent on it, you need it just literally to stay awake during the day. It's hard to find research on any negative side effects of Adderall. I've tried for years to see if others were experiencing what I was. But it's like everybody was keeping quiet about it. And I know what it was doing to me, and I couldn't have been the only one. For instance, Adderall causes a rapid heart rate, which causes extreme sweating and dehydrates you. This dehydration can turn into what's called dry mouth, and dry mouth for someone like me with old fillings is a very damaging thing. My fillings began to fall out, causing the need for major, expensive dental work, which I couldn't afford, and I ended up losing 4 of my teeth. Adderall also caused extreme weight loss. The first month I lost 20 pounds, and then more and more each month. I was weighed in at 104 pounds and was on my way to 100. I wore a 00, which was basically wearing children's clothing sizes. When there was no more fat left on me, my body began to eat my muscle. I was extremely malnourished, and you could see the skeleton structure in my face. I would like to point out that I also had routinely gone to the doctor and had visits every 3 to 6 months where they would weigh me and record it, but they never commented on it. Adderall keeps you very alert and awake, and most times I would go 3 nights without a night of sleep. And then the 4th day, I would crash all day and all night. Sleep deprivation is very dangerous and affects your brain's oxygen levels, your cell growth and repairs, any memory retention, and it causes you to hallucinate, which I did usually by the 3rd night. On nights when I had to sleep, I usually used alcohol or sleep aids to calm me down, which is a very dangerous cocktail because one is speeding your heart up and the other is trying to slow it down. But at the time, it was a safer option than what my doctor wanted to do, which was prescribe me sleeping pills and blood thinners. Because I rarely slept, when I did sleep, my body was under such extreme exhaustion that I would pass out in like a coma-like state, and not a person or an alarm could get me out of it. This made it very hard to keep any sort of schedule and caused me to lose countless numbers of jobs and put me in financial turmoil, especially since I was trying to keep up with my $200 to $300 a month habit. After 10 years of this extreme lifestyle, I became a very angry person, on edge, really paranoid and stressed out. I had major panic attacks that put me in the hospital a number of times. By now, I had lost 28 pounds, 9 jobs, 4 teeth, 4 boyfriends. I was in debt. My car was repossessed, and I was evicted from my apartment. All my relationships were in distress, and my heart felt so damaged that I could barely breathe. I had to struggle to catch my breath. Now I had a problem other than ADHD. I had an addiction. It's similar to a cocaine addiction. They say you become a cocaine addict after the first time you use. Coincidentally, cocaine is a central nervous system stimulant and a dopamine reuptake inhibitor, exactly like Adderall, which means both drugs prevent dopamine, the chemical that the brain causes pleasure in the brain, from being reabsorbed back into the brain after it's released. This results in an abundance of dopamine all at one time and causes a state of euphoria, which is a very addictive state to be in. The difference between the two drugs, though, is while cocaine lasts 30 to 60 minutes, Adderall can last 4 to 6 hours. This longevity over cocaine makes it a replacement party drug with way more potential for abuse. Lead researcher Carl Hansen, a professor of science at BYU, says Adderall is the most abused drug in America. And another scary fact is that Adderall allows you to drink twice as much as you normally could without passing out, which Mark Reed, director of counseling and development at Dick's House, says it's more dangerous because passing out is a mechanism your body uses to stop drinking. The fact that Adderall is preventing this can cause extreme, dangerously high alcohol levels in the body. So why is this drug the first place doctors go to when people say they're ADHD? I know this to be true because recently I visited a doctor again seeking help with my ADHD symptoms, and again right away he pulled out the prescription pad and tried to write me a prescription for Adderall. It was that easy. I went on to explain to him my 10-year addiction and struggle with this drug, Adderall. And he began to tell me that the doctor began to tell me that this is the #1 party drug, and it is sought after more than cocaine, he said. It got me thinking, then why are you handing it out like candy? Why is it that I have never been asked my history of drug or alcohol abuse? If I've ever tried stimulants before, if I was even pregnant and capable of taking narcotics. I wasn't this time or the last asked if I had real proof that I was ADHD, like a written diagnosis. All of this I wondered, all the while him knowing of this drug's potential for abuse. Doctors are prescribing the stimulant far too easily to a rapidly growing number of patients without a second thought. Once the script is written, there's no proper monitoring of the patient and how they interact with this highly addictive drug. Stimulants can alter your brain structure and brain function, causing depression, physical burdens, anxiety, and cognitive damage. There needs to be thorough examinations and written diagnosis of an ADHD condition before any of these types of drugs are prescribed. And only after exhausting all other options should the patient try stimulants, and then they should have regular examinations, psychotherapy, and their weight and nutrition monitored closely. I'm sure there's some cases where Adderall is the only thing that helps someone with ADHD symptoms, but it needs to be regulated, and there needs to be more responsibility had by those who so freely hand it out. The patient needs to be educated of the consequences and the power of this drug. It is too easily attained because there's no requirement or documented proof when telling the doctor you have attention deficit disorder. They will immediately prescribe the most widely used and widely abused drug for this condition, which is Adderall. This is a very sobering fact to an addict like me.